between teachers and others in those schools and our formal clinical services.
Daniel, let me bring you in, because obviously you have been through the care system. I think you had post-traumatic stress disorder that wasn't identified. What was your experience in terms of the support you were offered or not offered?
I wasn't offered any, actually, which is quite sad. 25 years it's taken for me to actually get a diagnosis. I've just gone through a process which many kids that leave care nowadays go through, and basically you can get access to your historic files. By getting that access to my historic files, what I found is it's actually written within my files that there was no funding available. And whilst this is historic, I'm really worried about, some of the cuts that are being pushed by the government at the moment, and how this is going to affect some of today's care leavers.
So what actually happened to you?
I was sexually abused. My mother and my father, they were previously looked after children, so we were considered a vulnerable family. And obviously part of the safeguarding of children is, I was taken into care, on a temporary basis, and this happened throughout my life. But I had a really good care experience. I had some really good foster parents, and I've got some really good memories from that.
Natasha, Daniel was mentioning funding. Yeah. I mean, is it bluntly an issue of resources? We know in sort of the era of austerity, there's been continual paring back. Is it an issue of austerity or awareness?
Both, I would say. I mean, we know that historically mental health has only been given 0.7% of the entire NHS budget, despite the fact that 1 in 3 GP visits is for a mental health issue. But because mental health can't be seen, it's not seen as being so urgent. And just one example of that, there is a fantastic organisation called The Foyer, which is in Braintree, which looks after children who are homeless, aged 16 to 25, so young adults essentially. It gives them a place to lay their head. It teaches them social skills, cookery, CV skills. That is in danger of being closed by the local council. Now, I can think of 200 things in Essex that I would sacrifice before I sacrifice that. But because most of the time we don't hear from young people like this, it's very easy to silence them and ignore them. So well done for having this young man on.
And yet, I listen to government ministers, and again and again they stress how mental health has been given an increased priority. So how can this be happening at a time when the government is repeatedly trying to refocus attention away just from physical well-being to mental well-being?
So I think in the last 5 years or so, we've seen a tremendous change in society about attitudes towards mental health, much greater willingness for people to talk about mental health in public and share their stories. And that is beginning, and I'd stress the word beginning, to change political attitudes, to getting politicians seeing this as a priority. But I think it's hard work to shift the funding, and that's the point we've reached, that you can't talk in public about mental health being a priority if you don't back up your actions by the level of funding it attracts.
Daniel, I see you nodding your head there.
Yes, I've read the report, and I just really want to stress that the report actually says that 50% of children that are in care or leaving care have mental health disorders at the moment, and these are going pretty much undiagnosed. One of the things that I saw in the report, which it's going the right way, there is support for previously looked after children pretty much up until the age of 25, and that's a recommendation that they put in place. So I'm passionate about about kids that are in care and them getting the right support. But, I mean, let's face it, 23% of adult prisoners have been in care. Now, that's about 21,000 people currently in the prison system that were in care. And we need to start asking questions as a society, why are we allowing this? It's definitely something we need to focus on. If we look at finances, it costs about £65,000 a year to keep a prisoner in prison. Now, if you work it out over 21,000 people, that's £1.5 billion a year spent, when we could be really taking that money and investing back into mental health services and getting the support early, not when it's too late and these people are pretty much left voiceless in society.
So, I mean, Natasha, given that there are, obviously huge savings to society, huge savings cost-wise, you're sitting in government. What do you do to try and ensure that those sort of savings can be achieved and to rectify the problem? What do you think, if you had to kind of list 3 bullet points to do?
Yeah.
What would they be?
Well, just to make it absolutely clear, I don't work for the government. I'm not in the employ of the government, but I do advise the Department for Education about how we can work at a preventative level. This is what Daniel's talking about, is that we need to identify children who are vulnerable and give them the extra support they need as early as possible. Mental health is something that we need to be thinking about from birth in exactly the same way that we think about physical health, because the way that mental health problems often manifest in later life, as Daniel said, is through criminal activity. And by that point, you're looking at a huge cost, not only to that individual, but to society generally. So prevention, prevention, prevention are my 3 bullet points.
Same thought?
I honestly think
just a sec, Daniel. Daniel, just 1 sec, please.
Yeah, so there has been money promised for children and young people's mental health services. What the politicians need to make sure happens is that money actually translates into real further investment into frontline services like some of the ones we run that are screening in some boroughs, all looked after children for mental health issues, or reaching out to those young people from specialist services.
And Daniel, same thoughts to you. I mean, if you had your hands on the levers of power, what would you do?
I would ensure that there are regular checks and mental health assessments, psychological assessments, and I'll make sure all children in care are offered this service, and potentially throughout their life or their stay within the care system. And that's going to give us an opportunity to get in there early. But we can also look at other options as well. So, for example, one of the things that I'm trying to do is kind of bring more of a holistic approach to mental health. And I'm passionate about singing and music. And one of the things that I've done recently, I was inspired through going to a recent event. There were 700 children there who are currently in the care system, and we formed a choir called Voices Matter. And what we want to do is we want to work with care leavers and get them involved in that. And because, you know, there's a lot of emotion and expression that these kids or these young adults need to get out. And if we can get them and offer alternative approaches, I think this would really, really, help, these looked after children.
Okay, Daniel, folks, thanks very much indeed for your time. There you are, as a promotion for you, Dan.